Hello, my name is Dr. McGovern and I am your host for AMP1 Lab. I have my model here who is all the way from Africa. His name is Ismaila, and he's volunteered, because he had no choice, to help me talk about body regions. So you'll kind of notice that he is standing in the anatomical starting position. So that means he's facing forward, his palms are facing forward, and his toes are mostly facing forward also. That is called the anatomical starting position or anatomical standard position. So when we start like that, what we're going to do is just use him to talk about body regions. So if I'm talking about his whole head, that is called the cephalic region. Within the cephalic region, we're going to have lots of other regions. You would probably know them very commonly as, like, you look forward, as his nose, but that is the nasal region. His eyes is going to be the orbital region. His forehead is going to be the frontal region. His mouth is called the oral region. The tip of his chin, put your chin up like that, is called the mental region. When I turn him a little bit to the side, you can see his ear, and his ear is called the otic region. When I spin him all the way around, back here, the back of his head is the occipital region. So a lot of these names come from the bones that are underneath it. You're forward now, okay. Some of the other things is, if, lift your chin up, his neck here, all mammals have 7 cervical vertebrae. I usually ask the class, how many do you think a giraffe has? How many do you think a giraffe has? 7 is right. We'll just use him as our model, not for the question. So, you know, as you go through this, just kind of think, the nose is nasal, that's pretty easy. The mouth is oral. The tip of the chin is something you might have to study a little bit, because that's going to be mental. And then the ears are going to be the otic, because they look into your ear with an otoscope. Don't think of the eyes as anything but an eye. It's not optical. It is called the orbital region. That is where your eyeballs would be in your skull. We'll talk about that when we get to the bones. As he's standing here with his Superman outfit on, I'm just going to go down the center here. In the center here is called the sternal region. He had, and the reason that he's here is he was here because he had tetralogy of Fallot. They had to work on his heart. So he has a scar that goes from here down to about the bottom of his S here. And he has no problem showing his scar, which is right down the center of his stopwatch. So the stop of that, the center of that. So if we take his chest area here, on either side of the sternum are going to be called the pectoral region. That is his big chest that would be underneath the S of in Superman. If we follow his rib cage here, this big belly here is called the abdominal region. It's not that big, you're all right. So as we work our way down a little bit, this region here, which is his thigh, is going to be the femoral region, because the femur is in here. The tip of his knee, anterior, is going to be the patellar region. And then as we go down the shin, that's going to be the crural region. When we get to his ankle, that's going to be called the, that ankle, yep. That's going to be called the tarsal region, because their tarsal bones are in there. And then his whole foot is called the pedal region or pedal region. His toes are called the digital region, and his big toe, this one right here and this one right there, is called the hallux region. So every region has a specific name. If we take his upper body here, move over this way one bit. If we take his whole arm, and we'll show off his arm right here, the tip of his shoulder is called the acromial region. His big bicep here is called the geez, I don't blank. It's going to be called the brachial region. At the bend of the elbow here, where you would normally do a blood draw, is called the antecubital region, and the forearm region from the wrist to the elbow is called the antecubital region. So at his wrist, most of you probably know that this would be called the carpal region. His whole hand is called the manus region. His digits are going to be called the digital region, and his thumb is called the pollex region. So whereas the digits on his hand are called digits to his hand, his digits of his toe are called digital region also. You have to make the designation as to whether they're toe digits or finger digits. The palm of his hand is called the palmar region. So whereas this was the brachial, this is the antebrachial, the bend of the elbow is called the cubital. When we go around to the back portion, this is called the olecranon region. This pointy part of an elbow is called the olecranon region. So just giving you a quick recap while he's standing still. Acromial is the tip of your shoulder. Brachial is his whole arm, front and back. Antecubital is the bend of his elbow. The antebrachial is his whole forearm. And then we come to the carpal region. The palmar region is easy because it is your palm. The digital region is your digits 2, 3, 4, 5. And the thumb, even though it's called a digit, it has its own specific name, which is called the pollex region. This part is the palmar. This is called the metacarpal region. Okay, when we flip him around so that you can see the back portion, we've already done the cephalic region. The back of his head is called the occipital region. His whole neck is called the cervical region. Then we're going to go down his back, and his spine from here to here, where all the ribs are attached, is called his thoracic region. At the bottom of his, where his spine is called the low back, and it's also called the lumbar region. And then he in the back, turn this way a little bit, is going to have a hiney cheek and a hiney cheek. They are called the gluteal region. In between the two gluteal region, right where this little thing is called the sacral region. So the spine is going to be cervical, thoracic, then it's going to be lumbar, then it's going to be sacral, and then it'll go all the way down to the coccyx. So if we spin him around one more time in just a quick review of everything that we did regional wise, we are going to do the whole head, which is the cephalic. We're going to do the frontal, where the forehead is. The eyes is going to be the orbital region. The nose is the nasal. His lips are going to be the oral region. The tip of his chin is called the mental region. His ears on either side are called the otic region. And then his neck here, those 7 cervical vertebrae, is called the cervical region. Going down the front of him here would be the sternal region. And on either side of the sternal region is going to be the pectoral region. When we take his arm, just as a recap, olecranal, brachial, antecubital, antebrachial, carpal, palmar, pollex, digital. And if you practice, you'll get that quick also. When we go from here, this big belly here is the abdominal region. It is inferior to his thoracic region, right underneath the S here, okay? So one of the things while he's here, and he's being cooperative, we're going to talk about the anatomical directional terms. So he would always be standing in the anatomical starting position. That's going to be forward, and this is forward, okay? You look forward. And so as we do this, anything towards his head is called superior. Anything away from his head or towards his feet is called inferior. Anything to the back of him is going to be posterior. Anything to the front of him is going to be anterior. Some of the other terms that you'll see, posterior is also called dorsal. Because last week was Shark Week, you can always tell if you're at the Jersey Shore, that big fin sticking out is the dorsal fin of the shark. And on the underside of the waves would be where the teeth are. So this would be the ventral region. In anatomy, we'll use both dorsal and ventral, but it's also posterior and anterior. Anything away from his midline. So if we drew a straight line down here, anything away from his midline is called a lateral. An easy way to remember that is the quarterback, if we ever watch football again, is going to toss the ball to the halfback, and he does a lateral. Anything towards the midline is called medial, okay? So some of these terms will just become very familiar with you. If we just take an arm, this is called an upper extremity, it attaches here at his armpit. Where it starts here at his armpit, and as we go out to his fingers more distantly, this is called proximal, and then this would be called distal of this left arm. If we bend his elbow, the armpit, which is the axillary region, going to his elbow, this would now be the distal portion of that thing that we're talking about. If we're talking about his elbow or his forearm, it starts at the elbow and goes to the wrist. So this would be the proximal portion of his forearm. This here would be the distal. So you can see that you can use proximal and distal with lots of different regions. And so if we take his hand starts here, which is closer to the point of origin. The wrist would be the proximal portion, and his fingertips, once again, are going to be the distal. The same thing, put your foot down for a second, is going to be with the lower extremities. He's going to start up here, proximally, that's in the groin, and then it's going to go all the way to the bottom of his foot, which is going to be more distant or more distally. So if we just take his femur, or his, oh, you can hold on to me. This one here, it starts in the groin and it goes to his patella region. So this would be proximal, this would be distal. If we take his lower extremity, it's going to start at the knee and go down to his ankle. So this would be the proximal portion of his ankle. This would be the distal portion of his ankle also. So we can also, since you're here, go medial and lateral. This side of his forearm would be the one that's closest to the midline. So this would be the medial side of his forearm, whereas the side nearest to me would be his distal or his lateral portion of his forearm. We can do the same thing with his fingers. So this finger here that's going closer to when he's standing in the anatomical position, this would be the medial portion of his pinky. This would then be the lateral portion of his pinky. The lateral portion of his pinky is going to be next to the medial portion of his ring finger, and so you can see medial, lateral, medial, lateral, medial, lateral, medial, lateral, medial, lateral goes from side to side, and with the toes also. So I think I pretty much covered everything with my live model. You are my live model, right? So this is your modeling career, by the way. He has the ability to stand in the anatomical standard position, which is like that and like that. And so in that, his feet would be facing forward and his head would be facing forward, but his palms would be facing forward also. So that is a quick 10-minute review of everything. Now what I gave you in the canvas is some of the same things without a live model that they were talking about, that explains it in 2 and 3 minute videos that you can go over and over it again, so that when you finally get to taking the practical, this is going to be one portion of the practical, being able to know the parts of the body. And plus next week is going to be your first quiz, and the first quiz is going to be on anatomical directional terms. So terms like superior, inferior, lateral, distal, medial, dorsal, anterior, all of that stuff. So I will post that in the announcements for everyone who is going to start taking A&P1 Lab this week. If you ever have any questions, feel free to send me an email, and if you go through the syllabus, you'll see when I do have office hours, but I look at that throughout the day and I will get back to you as quickly as I can. So say goodnight to Ismaila, and you can wave to the crowd. Thank you.